Welcome to another exciting episode of In-Depth Eye Health Podcast Series, brought to you by iFocus and iHub Nigeria Initiative. The series provides incredible insight into topical eye health issues and also serve as a platform for continuous professional development for eye care workers. Thank you as you listen.
Hi everyone, I'm Dr. Isi Monye. Welcome to another episode of In-Depth Podcast Series. November is Diabetes Eye Disease Awareness Month, and our discussion today is on diabetes and how it affects the eye.
Hi everyone, I'm Dr. Mustafa Bature. Our guest for today is Professor Dennis Nkanga, a consultant ophthalmologist and a clinical lead Diabetic Retinopathy Service at the University of Calabar Teaching Hospital. You're welcome, sir, to the program.
Thank you for having me.
You're welcome, sir. So, sir, diabetes is one of the major health conditions the world is focusing on right now. How big of a problem is it in our environment?
Diabetes is a very big problem. It's estimated that there are about 460 million people with diabetes worldwide. And the number is increasing by the day. In Nigeria, the number is also increasing. As at 2014, it was estimated that there were about 6 million people with diabetes in Nigeria. The prevalence range varies from the rural communities to the urban centers, but the numbers are also increasing. It's expected that in the next 20 years, we will have over 109% increase in these numbers. And when you consider that diabetes does not just come alone, there are a lot of associated comorbidities, it's going to be a big problem. Unlike COVID-19, where somebody can have COVID and recover within a certain period of time, everybody who has diabetes will live with diabetes throughout their lifetime. So that shows the burden. When you use just the estimate of 6 million, you know that's more than the population of some states in Nigeria. So we can really have a state with everybody having diabetes.
Perhaps diabetes is a burden in our society. And diabetes is known to affect almost all organs of the body. In what ways can diabetes affect the eyes?
Diabetes affects every part of the eye, from the eyelid, where it can cause recurrent infections like styes, it can cause blepharoconjunctivitis, to the cornea, where it causes problems with sensitivity, loss of sensitivity of the cornea, tear film abnormalities, chronic bacterial ulcers, neurotrophic ulcers, even issues with contact lens wear, poor wound healing. The iris and the pupils are affected by diabetes. You have autonomic neuropathy affecting pupillary reaction. And when there is proliferative disease, you also have the iris affected and the angle affected. Diabetes is associated with glaucoma. It's associated with variable refractive outcomes on refraction. Diabetes is known to predispose to cataract. So people who have diabetes will tend to have early age-related cataract. And when they have very high blood sugar, they could also have diabetic cataract. Diabetes is associated with neuropathy, where the nerves that move the eye will be affected. Even the optic nerve will be affected. But the big thing that we are looking at in diabetes is what we call diabetic retinopathy. Diabetic retinopathy is the commonest cause of visual loss and blindness in the working age group in many communities. So it's not just a problem of blindness, it's also a socioeconomic problem. The quality of life of patients who have diabetic retinopathy is also affected when they begin to lose vision. So it's a major thing, diabetic retinopathy, and we need to do something about it, because when a patient who has diabetes also loses vision, the quality of life will be affected. Sometimes the duration of life will be affected. His ability to take his medicines and treat other conditions will also be affected. And many of these are young people who may be the sole breadwinner of their family. So the effect of diabetes will be devastating, not just on them, but on their communities.
Wow, sir. That's a really long list of ways in which diabetes can actually harm the eye. So how can people with diabetes protect their eyes from damage from diabetes?
So when somebody has diabetes, there's a lot the person can do to prevent retinopathy, the development of retinopathy. There are risk factors for the development of diabetic retinopathy. And when we understand those risk factors and work on them, then we can prevent or delay development of retinopathy. Part of it is living an active lifestyle. It's been found that retinopathy is associated with sedentary lifestyle. Another is healthy dietary habits. So if the person maintains strict, good diet, important for the control of the blood sugar, that will help. There are other risk factors, including cigarette smoking, alcohol ingestion, makes retinopathy come much faster. And we encourage patients who have diabetes to completely abstain from alcohol and avoid cigarette smoking. Obesity should also be handled where an appropriate BMI can be determined for the individual. That's a body mass index that's appropriate for the person, and we try to stick to that. It's important that the diabetes should be well controlled. Good control is associated, poor control is associated with development of retinopathy. It's also important for the person to have good blood pressure control. A high diastolic blood pressure or systolic blood pressure are both risk factors for development of not just retinopathy, but other organ damage. So all these are important for the person who already has diabetes. Optimization of medical treatment, but more than that, we recommend routine systemic eye screening for diabetic retinopathy for everyone who has diabetes, because it is very important that diabetic retinopathy be picked up early when it is still asymptomatic, so that treatment will be able to prevent vision loss.
Thank you so much, sir, for those tips, especially for patients with diabetic retinopathy. What are the other things they can still do to prevent themselves from going blind?
The other thing that they need to do from going blind, even if you have retinopathy, you don't have to go blind. The most important thing is not just to get treatment early, but to get adequate treatment and also stay in a system where the eye can be monitored within a certain periodicity. So the ophthalmologist will be able to determine, based on the findings in the patient, how often to see the patient and what to do for the patient. Many patients are treated with lasers depending on the type of retinopathy. Others are treated with injections, and all these kinds of treatments are readily available in Nigeria and in most places. So if we do this, maintain adequate control and get care from our physicians, Actually, because of the nature of diabetes, it's a multi-systemic condition. So we need a multidisciplinary team to handle the care for diabetes. But this team should be led by the patient himself. The patient should be enlightened. The patient should study and get to know his or her own condition so that he knows what to do at every point in time.
Thank you very much, Professor Nkanga, for joining us today. It's been a real pleasure, and thank you for your wonderful insight.
Thank you, sir, for coming.
Thank you for having me.
Yeah. Thanks.
Yeah. Thank you for having me.